Hi, I'm Dea Bultman. I'm the program director here at University of Maryland, Capital Region Health for the Family Medicine Residency Program. We are a small but mighty program accepting 4 residents a year in a suburban part of Maryland, about 30 minutes east of Washington, D.C. We are separate from our colleagues in Baltimore in that our hospital system only has 2 additional residency programs in internal medicine and pharmacy. We are otherwise the sole providers for a majority of the pediatric and obstetric care that occurs through our hospital system and in Prince George's County. Our mission is really to train socially conscious as well as clinically competent family physicians that ultimately would love to stay in our area to increase the primary care workforce. Our ideal candidate is someone who has professional identity that's very well formed. They usually come in and are able to identify exactly what type of family physician they want to be in their 10 or 15 year forward outlook. And they're able to really utilize the resources, both in people and resources, to help them launch their professional career. Our program is known for launching family physicians into the community regionally on the East Coast or even nationally or internationally to be primary care resources. So being able to take care of the entire community, whether that's in their own private practice or even joining other more well-established practices. I think that residents that also complete our training are well-versed in academia, being able to teach as well as assess and evaluate medical learners, and then also engage in some scholarly activity. I hope that the graduates of our program ultimately live fulfilling and well-rounded lives that impact their patients dramatically, but also gives them some worth and purpose in their day-to-day work.